So we have 12 different simulators altogether, 9 down here, and then 3 upstairs that respiratory gets to use. We have Laerdal, we have CAE mannequins, we also have one Gamard who is upstairs. So we have various capabilities. We have some that just have vitals. The ones that just have vitals are lightweight, which are really great so that when our EMTs come in, we can move those to stairwells and to the floor so they really get to feel what it's like when they're in homes and they have to figure out how they're going to move the patients.
Working with the mannequins is great because it helps me to get real-time feedback, but it also helps me feel more comfortable and confident when I do go to the hospital. It's basically like working on a real person.
It gives me an opportunity to take what I learned in the lab and practice it on real-life simulators. You can actually see their vitals, you can hear their real breath sounds, you get to practice your procedures.
Our upper end mannequin will actually give birth. That's the mannequin that you see behind me. So she is our most expensive mannequin. She's super great because she has HoloLens eyes. She'll track you. When you walk over there, she has a lot of different things programmed that she can say. She can scream at you, tell you not to touch her, she's feeling nauseated, those kind of things.
How are you feeling right now? On a scale of 1 to 10, with 1 being the best and 10 being the worst?
5.
Okay.
So we have an emergency room setting, we have an operating room setting, 2 hospital settings that look different from each other. We have a pediatric area, both a nursery and an older pediatric area. And then we have a street area for the EMTs when they come in. Students are really nervous when they encounter real people, especially if they haven't done the skill before. And so being able to practice skills down here with the simulators takes some of that nerves away.
If there is something that I do wrong or incorrectly, I'm able to be corrected right there at that moment.
You can practice over and over again, you can make a mistake before you actually go into the hospital.
We've learned to run the ventilators, we've learned to do procedures like NT sectioning and ET sectioning, and it helps as far as knowing the proper way to do it and the safe way to do it.
The skills I've learned working with the mannequins would be things like taking vitals, blood pressures, listening to breath sounds, setting up ventilators.
One of the great technology things that obviously has come out is virtual reality. We have a virtual reality program, it's called Virtual Patients. It allows our students to be able to do simulations from home. We're able to project that virtual reality onto a big screen so we can have a group. One person can have the Oculus on and actually be doing the skills while the rest of the group interacts with them and says, hey, ask them this question, have you thought about let's give them this medication. Any kind of medical skill that you would need to do, they can do here.